But yeah, I've known Sam for probably 40 years, mostly in the beginning as a colleague, when I was a younger physician doing emergency medicine first and then private practice internal medicine. And of course, in emergency medicine, he was always available for surgical consultation on our patients. And then my own private patients, he was my surgeon of choice, as they say. And it's been a wonderful professional relationship, and it's also a personal relationship. We're good friends outside the realms of medicine.
When I think of Dr. Mazza, I think of him as being, he sets the standard. And for all the years that I've worked with Dr. Mazza, he was really essentially ahead of his time. And the things that we try to accomplish today in our everyday care of patients is emulated through the practice patterns that he had for years. How he communicated with all of his patients, how he used all the staff as part of a multidisciplinary team. That when he took care of patients, he always had a standardized methodology for caring for those patients, and his patients always had outstanding outcomes.
I've known Dr. Mazza for most of my life, but I've been in practice here for 25 years, and one of the things that always impressed me about him was that no matter how busy he was, he had time for anyone who needed him, whether it was one of the staff, one of his patients, one of his colleagues. He was always available, and it was always his priority. Whatever he was needed for was the only thing that was going on at the time.
Before Sam came here, he served in Vietnam. A tremendous experience for him, not only to serve his country, but also to have exposure to all kinds of surgical conditions, which allowed him to hone his skills better. And over the years, he would regale us with many stories of his experiences in Vietnam, both surgical and non-surgical.
He was incredibly organized, and that gave people a lot of confidence that they were doing the right things for his patients. So his method for how he wrote orders for patients, how he did progress notes for patients, he was incredibly accurate with his management of patients, and so that made nurses feel confident that they were doing the right thing for his patients. He was an excellent teacher, very approachable, always willing to teach anyone anything new.
He has been a mentor to me. Anytime there was a difficult situation, surgery that required a particular skill, he was available. There were certain things that he did, particularly pancreatic surgery, that none of the other surgeons at the facility did, and he was superb.
As a surgeon, he was top of the line. And as primary care doctors, we always were glad to utilize his skills because he was always available. He was always excellent technically, and he was always good at communicating well with us what was going on, what he was doing, why he was doing it, and what the outcomes were.
I would say that the experience that this institution has had with Dr. Mazza here over the years has been one of always knowing that they rely on him. And even at this point in juncture in his career, he's always available to the institution and for the patients that need him. And I think that speaks to his devotion to his patients, the community of Holyoke, and the people that have been served by him and have been lucky enough to be a teammate of his.
Each medical specialty requires its own skills, and surgery, I think, is a little unique in that you have to have great interpersonal skills, have great diagnostic skills, and to be a superb surgeon you have to have great skills in the operating room. And Dr. Mazza is certainly one of the most skilled surgeons I've ever had the good fortune to work with.
I think the biggest plus for him was the force of his personality. He was loved by everyone because not only was he a good surgeon, but he was a wonderful guy. The OR technicians loved him, the nurses loved him, the colleagues loved him. Everybody had a great time working with him because his personality was such that it was a pleasure to be around him. Still is.
He was so successful that many members of families would see Dr. Mazza as a result of the great experience their family members had, and he was always viewed as a true team member.
one of the things that I've enjoyed the most is seeing his old patients and having to talk to each one of them about him. It's always the first thing that they have to say. They want to let me know how wonderful he is and what large footsteps I'm following in, and they want to know how he is, and that's always the first point of conversation.
Over the years, the contributions to our hospital and our communities have been extraordinary from Sam. This is reflected in why we're here tonight. He has patients who he took care of 30 years ago, still talk about him. So it's been an honor and a pleasure to work with Sam over the years, and I'm sure all my colleagues feel the same way. And we still work together a little bit, and now it's more of a friendship relationship. But we still reminisce about the good old days and all the cases we did. But now, a good glass of wine and a nice dinner, and we can talk about almost anything and still get along and have a great time. He's been an asset to the community since the day he arrived and continues to be so.
An outstanding, compassionate, excellent surgeon.
One of the greatest compliments to me would be to be compared favorably to him. For people to say that I remind them of Sam Mazza would be one of the greatest compliments.